My name is Bonnie. I'm a nursing student in Nevada State College, and I'll be doing your exam today. Let me just go ahead and get ready. I'm going to wash my hands and pull back the curtain for privacy and comfort. So, what is your full name and date of birth?
November is February 1st, 70.
Okay. Reasons for seeking care today?
My back hurt.
Did you have an accident?
No.
An injury? Or no? Medical history? Any diseases? No? How about any surgeries or trauma?
No.
No? Okay. Are you taking any medications?
No.
Do you have any drug allergies?
No.
Let's see. Family history. Is your mother still living?
Yeah, she had diabetes.
How about your father? Is he still living? No? Okay. Let's see. Personal habits. Do you drink?
No.
Oh, bless you. Do you smoke?
No.
Any exercise?
No.
No? Okay. Illegal drug use?
No.
No. Okay. So, first I just do a general survey. Let's see. You are 46.
Yes.
And you appear 46. You're awake and you're alert. Tell me, what is the date, the month, and the year?
April 2016.
And where are we right now? Okay, so you're oriented times 4. Very good. Your skin, I don't see any lesions. I don't see any rashes. Looks like you got a little bit of some sunburn on your arms, maybe a little bit on your face. Your posture, you're sitting up straight. You look comfortable. You look a little serious, which is appropriate to the situation, because we're doing an exam today. Your speech is clear and I understand you. First thing I'm going to do is I'm going to assess your head. So I look symmetric. I'm going to feel your head. Okay. You know, I don't feel any abnormal protrusions, no abnormal depressions. I'm going to look at your hair. So it's very thick, evenly distributed. No infestations. Your scalp is clean. Your skin, I don't see any excessive moisture. Let's go ahead and go to your external eye structures. Your eyebrows, your eyelids, your eyelashes, they're present. They are intact. I don't see any redness. I don't see any swelling. No discharge. I'm going to look at your sclera and your conjunctiva. So I'm going to put my hands on your face and lower your eyelids. You look up to the ceiling for me. Okay, so your sclera is, it's moist. It looks glossy. I don't see any redness, no drainage. I'm going to go to your ears. So, your ears, they are aligned, they're symmetric, they look equal size on both sides. No drainage, no lesions. It's very nice. Next thing I'm going to do is I'm going to perform some tests on your eyes. So the first test, what I'm going to have you do, it's called the pupillary response to light test. You go ahead and just look at one spot and focus on it. Let's go ahead and have you focus on my forehead. I'm going to shine a light in your eye. You just continue to focus on my forehead. Going to the other side. So I have direct light reflex and consensual light reflex. Next test is called the accommodation test. So I'm going to place one finger in front of your nose here. First I want you to pick a spot on the wall and focus on the wall. When I tell you to, I want to switch your focus to my finger, okay? So now focus on my finger. Now focus back on the wall. Okay. So I have bilateral convergence and I also have bilateral pupillary constriction. So that's good. Now I'm going to go ahead and and we have perla, meaning your pupils are equal, they're round, they're reactive to light, and you accommodate. Next, we're going to do the diagnostic position test. I need you to hold your head straight, follow my finger with your eyes. Okay, so parallel tracking of both of your eyes, cranial nerve 6 is intact. Now, what I'll do is I work through the body systems down. I'm going to assess the patency of your nose. I'm going to press down on your nostrils, sniff in. Okay, and do the other side. Sniff in. Okay. So, sniff is present, meaning your nostrils are patent. I do hear a little bit of some congestion. So, do you have a cold?
Yeah.
Yeah, you have a cold. Okay. Alrighty. Next thing that I'm going to go ahead and do is we'll go ahead and go down, look at your oropharynx. For that, I'm going to use a tongue depressor and a light. So go ahead and open for me. I'm going to press down your tongue. So your oropharynx, it is pink, no lesions, no exudate. Your tonsils are about +3. Uvula is midline. Go ahead and say ah. Okay. Uvula elevates midline. Let me check your gag reflex. Oh, sorry. So, I know that's uncomfortable. Gag reflex is present. Cranial nerves, number 9 and 10 are intact. So, very good. Next, I'm going to give you some directions. Just follow my directions. Go ahead and clench your teeth for me. Clench your teeth. Now, squeeze your eyes closed, tight. Wrinkle your forehead. You can wrinkle your forehead. Okay, good, thank you. Stick out your tongue. Puff out your cheeks like a chipmunk. Good. Okay. So, cranial nerve number 7's intact. I'm going to go ahead and look at your tongue. And stick out your tongue for me. Your tongue is pink. It's a little bit of looks like almost a little crack in the middle of your tongue. May need to drink a little bit more water there. Go ahead and stick out your tongue again. Touch the roof of your mouth with your tongue. The underside of your tongue is moist and it's smooth. Good. I'm going to touch your tongue here. I'm going to move it to the right and left. Okay. So I don't see any lesions, no ulcerations. Cranial nerve number 12 is intact. So, next thing I'm going to do is I'm looking at your neck and your neck structures. You're holding your head erect and still. Very nice. Let me assess your tracheal position. I'm going to put my finger in your sternal notch here. Okay, so that area is equal. Your trachea is midline. So I'm going to go ahead and feel your for any lymph node swelling at all. So I'm going to touch that here. Thank you. So lymph nodes are soft, they're palpable, they're discrete, and they move. They move when I touch them. So that's all really good. I'm going to listen to your carotid arteries with my stethoscope. Okay, other side. Okay. So I don't hear any bruits. Very nice. You know, normally I would do the abdominal assessment, but I think just to prevent you from getting up and down, I'll do your deep tendon reflexes first. So I'm going to have you sitting on the table. Do your upper extremities first, starting with your biceps. equal and plus 2. Let's go to your triceps. I'm going to put my hand, support your upper arm. You just let that arm go dead. Other side. Let that arm go dead for me. I'm going to hold you. Equal. I'm going to say plus 1. Going to your patellar reflex. Other side. Okay. Plus 2. Equal. Thank you. I'm going to assess your Achilles reflex. I'm going to kind of hold your foot in the tap your tendon there. So equal plus 2, very nice. Now I'm going to assess the strength of your upper body here. I'm going to put my hands on your shoulders and push down. You shrug your shoulders against that resistance. Okay. Equal, I'm going to say 5 out of 5 strength. Now I'm going to assess, I'm going to put my hand on the side of your face, and I'm going to have you looking towards the left side, and I'm going to put resistance on you. Okay. Now the same thing with the opposite side. My hand is on your right side of your face. You look to the right. Good. Very strong. 5 out of 5. Equal. Let me see how strong your grips are. I'm going to put my 2 fingers in your hands, and you squeeze me tight. Okay. 5 out of 5 strength, and they are equal. So, let's see. Let's go ahead and assess your range of motion. No, you know what? I think we'll do the Romberg test. You can stand up, thank you. Romberg test, what I'll have you do is you can face me. Feet are together, your arms are at the side of your body, and I'm going to have you close your eyes for 20 seconds. Go ahead and close. Go ahead and open. Okay. So, negative Romberg, when you closed your eyes, you didn't lose your balance, so that's what I was looking for. Very good. Let's go ahead and range of motion, upper extremities. I'm going to tell you what to do, but you can also follow my movement. So arms up, behind your head. We're going to turn to the left, to the right. Good. Now arms down. Wonderful. Full range of motion of your upper extremities. Very nice. And let's see. I'm going to go ahead and look at your spine. So your spine appears straight. I have your horizontal planes are equal. Let me look at the side here. Convex thoracic curve. Let's assess the range of motion of your spine. Go ahead and touch your feet for me and come back up. Go ahead and tilt to the side. Now the other side. Back. Back. A little bit back. There you go. And then twist your shoulders to the left, to the right. Good. Full range of motion of your spine. Go ahead and walk forward for me and walk back to me. So thank you. Your walk is even and it's well balanced. Now what I'm going to have you do is I would have to have you lay down. So let me help you with the chair. Before you lay down, I'm going to just check your CVA tenderness. Put a hand on your back here. Okay. Was that painful or? Okay, so no CVA tenderness. Go ahead and lay down for me. I'm going to pull your shirt up just so I can see everything. So I'm just looking. Your abdomen is equal in color. No redness, no lesions. I don't see any pulsations. No peristalsis movements. You're flat. Very good. I'm going to listen with my stethoscope. You're going to feel my stethoscope against your belly. You need to listen for 10 seconds in each quadrant. I hear vowel sounds in all 4 quadrants, normal, active. Now I'm going to go ahead and percuss your belly. So I'm going to be putting my hand on your belly there. Listen, and tapping that hand with my other hand to see what sound it produces. So I have tympani throughout. Now I'm going to go ahead and palpate. Some light palpation. You okay? Good. Now some deep palpations, 2 hands. Trying to relax, breathe in and breathe out. Okay. So, I didn't feel any masses and I didn't feel any enlarged organs. So that's very nice. Now I'm going to continue on with the lower extremity range of motion. Go ahead and maybe you can put your... Okay. So with one leg at a time, raise your leg up as high as you can go. Bend your knee. Now rotate that knee towards the right side of your body and then bring it back to the left. And then down. Okay. Same movement with the other leg. Straight up. Bend your knee. And bring it towards that left and back across a little bit. Okay. And down. This is going to be a little bit harder. Heels together. Thank you. And then heels back together. Okay. Thank you. So full range of motion of your lower extremities. We made it